I will be performing this assessment on Garrett. First, show you the room. There's nothing to help. Okay. So my first steps before I assess the patient, I would check the patient chart outside the room or any doctor's orders. I would provide privacy for the patient, which I've done by closing the door. I would then ask the patient to use 2 identifiers to ID themselves. What's your name?
Garrett Lobdell.
And your date of birth?
February 6, 1993.
And then I would wash my hands, and I can start the assessment now. I'll introduce myself. My name's Abby. I'll be performing your assessment today. What brings you in today?
Here for my checkup.
Okay, and to begin the assessment, I'll first ask the patient about any pain they're having. On a scale of 1 to 10, how would you rate your pain? 1 being no pain, 10 being the most pain?
1.
So he's experiencing no pain. From there, I would assess the neurological aspects of the patient. His posture is erect yet relaxed. He appears well groomed and clean, as well as dressed appropriately for the weather. And he is not exhibiting any unintentional body movements or tics. His behavior, his level of consciousness is alert. It does not have any slurred speech. He is easy to understand. His expression is also relaxed and appropriate, and his mood is appropriate for the situation. To test orientation, I would ask, do you know your name?
Yes.
What's your name?
Garrett Lobdell.
Do you know where you are?
Yes.
And what year is it?
2018.
Patient is alert and oriented ×2, and his thought process is easy to follow and logical. I would first assess his skin. His skin appears healthy, appropriate for his ethnicity. He doesn't appear to have any lesions, and the skin is intact. For temperature, I would feel his skin with the dorsal side of my hand. He appears to be warm bilaterally without being feverish, and his skin is dry. There's no moisture or sweat. I would next test his skin mobility and turgor by pinching the subclavicular area, so just about below his collarbone. The skin is easily pinched, meaning he has good mobility, and it snaps back into place quickly, which means he has normal turgor. Next, I'll palpate, or I will assess his hair. It seems to be evenly distributed throughout the scalp, as well as the color is evenly distributed. He doesn't appear to have any thinning or balding. I'll palpate the scalp next. Tell me if you feel any tenderness.
Nope.
He doesn't feel any tenderness. The skull feels to be normal cephalic, round and symmetrical. Feeling his hair, it is thick and healthy feeling. There's no hair falling out, and it's not very stiff, so it's healthy. Next, I would assess his neck. The neck itself appears to be symmetrical. There's no discoloration, lesions, and the skin seems to be intact. I will palpate his lymph nodes next, starting with the pre-auricular, post-auricular, occipital, superficial cervical, posterior cervical. Lean your head to one side, deep cervical on his left side and the other side, deep cervical on the right side, and the supraclavicular. Did you feel any tenderness when I was feeling your lymph nodes? No tenderness, and none of them appeared to be swollen. I also forgot to when assessing the head to feel his temporomandibular joint, the TMJ. It doesn't appear to be swollen at all. Can you open and close your jaw? There is no clicking, and it opened and closed symmetrically. And that will also demonstrate cranial nerve 5, as well as his ability to feel my hands touching his face. Do you have any kind of jaw pain ever?
Nope.
Okay. Have you ever noticed any skin lesions or unnatural looking moles or
nope.
Nothing to worry about? Okay. From there, I would then palpate his temporal arteries. They are equal bilateral, 2+. Then from there, I'll assess the eyes. I'm going to assess cranial nerve 7, actually. Raise your eyebrows, puff out your cheeks, and smile. Patient displayed intact cranial nerve 7 as the facial movements were symmetrical. And then to do an assessment on the eyes, looking at the eyes, the corneas are symmetrical. They're both the same color. There's no opacities. The sclera is white. And pulling down the eyelids and up, the conjunctiva appear to be pink and moist. There's no additional drainage or mucus going on. And then I'm going to check for Perla. Looking at his eyes, his pupils are symmetric and round using the pen light. Checking for pupil constriction. Both pupils constricted to the symmetrically and bilaterally to both direct and consensual light. I will then check for accommodation by having Garrett look over my shoulder at a point in the distance, and then looking at my pen light. Both pupils constricted and converged bilaterally. And then to collect some subjective data from the patient, do you see an ophthalmologist?
Mm-hmm.
Do you wear glasses?
For reading.
Are you familiar with the Snellen chart?
Yes.
And when you have your glasses on, are you able to read it?
Yes.
Okay, so the patient being able to see the Snellen chart demonstrates an intact cranial nerve 2. To check cranial nerves 3, 4, and 6, I'm going to have the patient, Garrett, look at my pen light and follow it with just your eyes. Don't move your head at all. Patient was able to follow the pen light in the 6 cardinal directions, demonstrating intact cranial nerves 3, 4, and 6. And I believe I forgot to do cranial nerve 11 when assessing the neck area. So I'm going to put resistance on your shoulders. I just want you to raise your shoulders. And drop. Patient has intact cranial nerve 11. And then I'm going to test neck strength by putting my hand against the patient's face and turn into my hand. Okay, and on the other side. All right, patient had symmetric bilateral neck strength. Next, I'm going to assess his ears. Do you have any hearing problems?
Nope.
Do you have tubes in your ears? Do you have any history of any kind of ear problems?
Nope.
Okay. They do appear symmetrical and appropriate for his body size. They are aligned with the lateral portion of his eyes. I'm going to push on or palpate your ears. I want you to tell me if you have any tenderness. I'm palpating the tragus, pushing it in, pulling the pinna, and pushing the mastoid process. Did you feel any tenderness?
Nope.
Okay, you didn't feel any tenderness. Next, I'm going to take a look in the ears with my pen light. Okay, there aren't any lesions on the inside of his ears. It appears healthy in there. There's no excessive hair or cerumen, as well as no drainage or foreign bodies present. Next, I'm going to assess the mouth. Do you have history of any dental work?
No.
Do you have you ever had any history of like lesions on your mouth?
No.
Chronic lesions? Do you have your tonsils still?
Yep.
And then have you ever experienced any kind of sores in your mouth?
No.
Nothing? Okay. All right, so the lips are pink, moist, and symmetrical. There's no signs of any lesions right now. Open your mouth and stick out your tongue. The tongue is midline, and to demonstrate cranial nerve 12, I'm going to have you say light, tight, dynamite.
Light, tight, dynamite.
Patient demonstrated intact cranial nerve 12. I'm going to take my pen light and a tongue depressor and look at the inside of his mouth. The teeth are intact and don't display any sort of decay that I can see. His gums, his buccal mucosa, uvula, soft and hard palate appear to be pink and moist. His tonsils, I would say, are +1. They aren't red and swollen at all, and I can't really see them. So next, to test cranial nerve 9 and 10, I'm gonna again put tongue depressor in your mouth and check that your uvula rises when you say ah. And if you could kind of like gag almost. Okay, so that those two tests demonstrate cranial nerve 9 and 10. And then we will assess the nose. The outside of the nose appears to be intact. There's no lesions on the nostrils. I'm going to test for patency by having Garrett, I want you to hold one nostril closed and breathe. And now the other nostril closed and breathe. Were you able to breathe easily through each nostril?
Yes.
Okay, so he has bilateral patency. And I'll take a look inside nostrils. Okay, the nostrils do look symmetrical. There's no excessive hair or mucus inside. The septum is midline and doesn't seem to be perforated at all. The septum. And the lining is pink and healthy looking. And next, I'm going to test his musculoskeletal system. First, I'm going to have you stand up, and I'll have you walk towards the camera and back. Okay, he doesn't appear to have any abnormal gait or like a limp. Next, we're going to test cranial nerve 8 again by having him perform the Romberg test. I'll have you stand with your feet together and close your eyes. Okay, he didn't exhibit any swaying, meaning he has good balance with his eyes closed and his feet together, meaning he has an intact cranial nerve 8. Next, I'm going to have you sit back down. To test his coordination and sense of position, I'm going to have you touch the tip of your nose with your right pointer finger, yep, and then your left pointer finger. And I'm going to have you put the heel of one foot on the shin of the other leg, slide down, and on the other side. Okay, so he was able to easily touch his pointer finger to the tip of his nose, as well as sliding his heel down each shin straight, meaning he has good coordination and also a sense of position. Next, I'm perform some range of motion. So I want you to stand up again. We are going to, I need you to extend your elbows first, both, and flex. Put them down by your sides and pull them away from your body. Abduction and towards your body. Adduction. Then I'm going to have you do some arm circles, circumduction. You can sit down. I'll have you put out your foot, move the foot in towards the ankle and away from the ankle, inversion and eversion, or extroversion, and then the other foot in and out. Okay, he displayed a normal range of motion. Next, I'm going to test his upper extremity strength by performing the finger grip test. I'm going to have you grip each finger tightly. Okay. He demonstrated bilateral grip strength, asymmetrical on each side. And next I'm going to have you put up your hands like this. I'm going to push on your hands first, you'll resist it, and then I'm going to pull on your hands and you'll resist it. Okay. Garrett demonstrated symmetrical resistance against my push and pull. Next, I will have you turn around on the bed. I'm going to check his thyroid gland. Have you sit up really straight, lean your head a little bit forward and to the right. I'm going to push his trachea over a little bit to the right with my left hand. And I'm going to put my right fingers between his sternomastoid muscle and the trachea and have him swallow. Okay, and then next we're going to do the other side. So lean your head to the left. I'm going to push the trachea to the left with my right hand. Put my left fingers between the sternomastoid muscle and the trachea and have him swallow again. Okay, the thyroid gland didn't feel swollen at all. It seemed to be midline and not out of place. Next, I'm going to test his Babinski reflex. I'm going to have you turn around on the bed that way and lay down, stick out your feet. To test the Babinski reflex, I'm going to take a pin and run it up the lateral longitudinal arch of his foot to check to see what kind of reflex he has. So starting at the heel and moving up the side of the foot. Okay, he had a normal reaction to that test. It would be considered reflex. And so normal. You can sit back up. Next, I'm going to have you lay down on your back in a supine position this way. I'm going to test his lower extremity strength. First, I'm going to have you lift your left leg as high as you can and put it back down, and lift your right leg as high as you can and put it back down. Did you feel any tenderness at all?
Nope.
Have you ever broken any bones that you can think of?
Nope.
Any problems like walking that you feel, of any tenderness you feel?
Nope.
So next I'm going to test, do the push-pull test on his feet. So I'm going to have you resist my push and then resist my pull. So resist my push, resist my pull. All right, he exhibited bilateral symmetrical resistance, which is good, and he has normal strength with that. And then To go back over the cranial nerves, because I believe I missed some. Cranial nerve 1, if I held coffee in front of your face, would you be able to smell it?
Mm-hmm.
So he has an intact cranial nerve 1. Cranial nerve 2, he demonstrates at his doctor's office when he goes for his checkups. He has to read the Snellen chart with his glasses on so he can see it. Cranial nerves 3, 4, and 6, he demonstrated by looking in the 6 cardinal directions where I held my pen. Cranial nerve 5, he demonstrated by moving his jaw up and down as well as being able to feel my touch on his face. So facial sensation is part of cranial nerve 5. Cranial nerve 7 was demonstrated by the symmetric actions of his face, so raising his eyebrows, puffing his cheeks, and smiling. It was the same on both sides. 7, 8, cranial nerve 8, we did not test. To test cranial nerve 8, I would perform the whisper test. So I'm going to have you turn around again. So the whisper test, I'm going to whisper a word on one side of his body, and I will have him tell me what I whispered as well as which side it was on. Okay, you ready? Do you know what I said?
Yes.
What did I say?
Red.
And what side did I say it on?
Right.
Okay, we're going to do it one more time. Do you know what I said?
Yes.
And what did I say?
Blue.
And what side did I say it on?
Left.
So he has a functional cranial nerve 8, being able to hear me whispering and being able to tell me which side of his body I was whispering on. Next, the 8, cranial nerve 9 and 10, he demonstrated by gagging as well as saying ah. Cranial nerve 11, he demonstrated by being able to resist my push on his shoulders and shrug his shoulders. And cranial nerve 12, he demonstrated by his tongue being midline and being able to say light, tight, dynamite. So after these assessments, so I finished my assessments, I would make sure the patient was comfortable in his room, whether he was waiting for the doctor or staying at the hospital, and I would go document any findings that I found in my assessment. That's it.